for all those MBBS aspirants. We have with us today my role model and one of the perfect doctors I have ever seen, and gentleman, Dr. Govind Mittal, sir. I always consider him as a ideal role model, and I have been emulating him since my MBBS days, first year of MBBS. He has been a source of constant motivation and source of guidance, support to me. So I thought he's the perfect mentor to go guide any juniors to the field of MBBS. So when I requested him, he readily accepted the request, and he is with us today. He's a busy consultant dermatologist and dermatosurgeon in Bangalore. He has started his own clinic, Therapia Skin Center and ENT Center in Basavangudi, Bangalore. To mention some of his achievements, it would be a big list, of course, but to mention a few, he studied his MBBS from the most prestigious Bangalore Medical College with every year taking distinctions, and also was the best outgoing student, I remember. After that, he did his MD dermatology from another premier institute of a country, that is Christian Medical College, Vellore. After that, he went on to do fellowship in dermatosurgery again in Bangalore Medical College, and he has so many fellowships and other things for his credit. More than everything, he's a very good senior, very good mentor. He's a very good human being, more than a doctor. So he can motivate you, he can inspire you, he can guide you with this fullest energy and in a perfect manner, possible manner. So, sir, thank you so much once again. On behalf of all the members of White Army, we thank you for your valuable time. And also, once again, we thank you for accepting this request to conduct the session. And as a moderator today, we have Miss Priya Ashok, who is a fourth year student from MS Ramaya Medical College, Bangalore, also a core member of White Army, who have been, in fact, it's her idea to conduct this session. So, welcome to you, Miss Priya. And also we have another budding doctor and also a first year medical student, Miss Charushi Jain, who is a first year medical student at MS Ramaya Medical College, who has recently cleared all this counseling and also admission into MBBS. So we thought it would be apt to share her experience as well for the new aspirants. So welcome to you, Miss Charushi. We also have so many aspirants who have already cleared NEET and waiting eagerly to get into this MBBS field. So we all welcome all the aspirants, all the students who are watching this session to this. If you have any doubts or if you have any clarifications, you can put it in the chat box, or you can ask directly the mentor at the end of the session. So over to you, Miss Priya.
Thank you, sir. Good evening, Govind, sir. So, shall we begin the session?
Before we begin, first of all, thank you so much for such wonderful, kind words of appreciation, Dr. Kishan. It is only, befitting for me to be associated with such a wonderful student such as you. I still remember the day I conducted the MBBS orientation program for your batch when you guys had joined in the new digital library complex of Bangalore Medical College and Research Institute. And of course, when you asked me to do this talk, this topic is close to my heart. And the beauty about this is I get to associate myself with the young teenagers, of today and the future of tomorrow's healthcare industry in India. So I just want to start the talk or start the session saying that, this journey of learning and mentoring has to continue. I had some mentors because of which I am what I am today. And I hope that the generation or all those who are listening to me today will mentor their juniors in the same way or maybe in a much better way, so that we can keep this journey of learning and mentoring always. So without too much of talk, let us start with the session proper. And thank you so much, Kishan, for having me here.
So the first question, which a lot of parents and a lot of students want to know, is about how many medical seats are there in India.
Okay, fine.
In Karnataka.
Okay, great. So one piece of introduction which Dr. Kishan missed out is that I'm also a board advisor to a brand, to a company which actually deals with medical admissions or helps in medical counseling process, that is medical mentors. So a lot of information that I would be presenting today or talking about today is thanks to the team of medical mentors who have compiled a lot of data and helped me with the same, so that I can present to you people today. So number of medical colleges in India is, we have a total of 278 government medical colleges, 278 government medical college, including central universities, which has about 41,902 MBBS seats. Okay, 41,902 MBBS seats in government medical colleges. Now in private medical colleges, we have total of 33,115 MBBS seats spread over 229 colleges. And we have 8,200 MBBS seats in 45 deemed colleges. Okay, so we have close to almost about 88 to 89,000 MBBS seats.
89,000 MBBS.
Yes, and in Karnataka is what you were asking, right?
Yes.
So in Karnataka, around last year we had around say 6,500 seats, and this year they're saying that probably we'll have around 7,500 seats totally in Karnataka once we have the final matrix about the approved colleges. I think just day before yesterday, there are about 4 colleges which were supposed to get approval and not got approval. So there have been some updates about that, but we are expecting about close to say 7,000 MBBS seats in Karnataka alone.
Sir, also reassuring thing is the seats keep increasing every year. Maybe
Yes.
Few thousands of seats might have been increased this year. So if you look into the last year's seat cutoff, we can expect some again 2,000-3,000 extra seats this year, and also the ranks. They will be getting a high chance of getting MBBS seats this time. What do you say, sir?
Yes. So if you want me to elaborate a little bit about the exam that happened this year.
Yes, sir.
So yeah. So this year totally we had 16 lakh registrations, 16.14 lakhs, out of which 9 lakhs were girls and 7 lakh were guys. Okay, NEET aspirants. Now out of these who registered, about 15 lakh appeared for the exam.
Okay.
All the 16 lakh did not appear for the exam. About 15 lakh appeared for the exam, and 8.7 lakh students qualified.
Okay. Okay.
Now the challenging figure here, Dr. Kishan, is that this is 1 lakh more than last year.
Okay. Okay.
So last year, about 7.7 lakh candidates that in 2020 had qualified. This year, we have around 8.7 lakh qualified students. And by qualification, I mean, there is a qualifying cutoff, as all NEET aspirants will be aware of. So this year's general category cutoff is 138, whereas for OBC, SC, ST, the cutoff is 108. Okay. So anyone who has scored out of 720, if he has scored above 138 in general category, has qualified. So we have around 8.7 lakh students who qualified. And guess where are the maximum number of qualified students from? More than 2 lakh from Maharashtra, 1.9 lakh from Uttar Pradesh. Karnataka forms among the top 6 states with about 1 lakh qualifiers.
So sir, around 1:7 now. So nearly 1 lakh seats are there, and 7 lakh students are qualified. So even though 7 lakhs students are qualified,
I would say maybe 1:8 you can make it, you know.
okay,
Yeah,
because
because
because we need to be a little more lenient, sir. Because out of 7 lakh students, those who qualified, all will not go into the medical, right, sir? Many
I will tell you the lenient figures. The lenient figures, yes, the lenient figures we are coming to is how many people appear for the counseling. For example, this is last year's figure. So out of the about 1 lakh students that actually registered from Karnataka, 1.1 lakh would actually registered, and around 1 lakh appeared, and around 55,000 qualified. This was in Karnataka.
Okay.
55,000 students qualified, but only 31,000 students appeared for the counseling.
So almost 50%.
30% of those
30%,
students,
not even, less than 50%.
30% of those who registered actually went for the counseling. So all those 16 lakh students have, appeared for the exams, or rather 15 lakh students have appeared for the exam, and 8.7 lakh students have qualified. Those who would be attending the counseling may be just about 3 or 4 lakhs.
3 or 4
so
lakhs.
That is your actual competition. So don't be too worried, students. Don't be too hassled. As per the government norms, anyone who's got above the category cutoff or above the general cutoff, so if you have got above 138 and 720, you still have a chance to get a medical seat. All that will vary is how much you will pay for that seat and how good a college you'll get. In the sense, if you have an affordability issue, then obviously you should have a higher mark range. If affordability is not an issue, even with slightly lower marks, you should be able to land up with a medical seat. Now, where you will land up, there are a lot of factors. So I hope that stats makes things a little better. The one more piece of stats, since we are discussing so many stats, I thought let me finish off all the stats together. Is comparison of this time's performance with last time's performance. Now, one of the common feedback that we got is that this year's paper was very tough, and not many people would have got. But what we saw in the actual ranking, Dr. Kishan, is that there were good number of people who scored above 600, 650. Okay. And in the sense, those, so anyone who got above 650 or got 650 or above will get a rank of up to 4,000. Okay. So 4,075 was the rank for 650 marks. And anyone who got above 600 gets a rank between above 18,500. So, and anyone who gets above 500, the ranking is 84,000.
So see, one mark also makes a lot of difference. Thousands, the rank will fall down.
Yes. So the concentration of ranks, the real competition comes if you have scored less than 500. If you have scored above 500, you should be assured of a seat. Because your ranking is 84,000 and there are 89,000 seats. Of course, there is category, there is reservation and all that stuff. I do understand. But if you are placed above, say, 550 and that, you should be able to get a seat. How to get a seat? Yes, there are different dynamics, but you should be able to get a seat. Now, the competition is really high if you have scored less than 450. Okay, so I hope these figures are making sense.
Yes, sir.
Okay, great.
So since you have touched on the aspect of different seats which are there, different types of seats which are available, could you please shed some light on the seat matrix? That is, what is government seat and then private seat, deemed university, the different ways one gets into these colleges?
Okay, fantastic. Now, basically, there are, if I would try to say, there are two primary counseling procedures. Okay, so the two primary counseling procedures is the MCC, that is Medical Counseling Committee, and then you have the state counselings, okay, through which you can get a seat in MBBS in India. So now through the medical counseling committee, that is the MCC portal, counseling is done for almost 5 major categories. You can get into the AIMS JIPMER set of colleges, you can get into AFMC, you can get into All India quota, and you can get into deemed. So the counseling for all these colleges happens through the MCC portal. Okay, so that is you have the All India quota counseling, and for the state colleges we have the KEA portal. Like in Karnataka, you have the Karnataka Examination Authority or KEA portal. Like that, several separate states have their own counseling conducting authorities. In Karnataka, it's KEA. Like that, in every state has their own authorities that conduct the counseling. Now, just to tell you a little bit about the counseling schedule. Okay, so how does this counseling happen? Now, on the MCC portal, we do the counseling for All India quota. What is All India quota? All India quota means 15% of seats in all government medical colleges across all the states in India is called All India quota. If you belong to any state across the country, you still can claim a seat in any other state in the country through this All India quota. Even if you are a student from Rajasthan, you can claim a seat in Tamil Nadu. Okay, through the All India quota, which is 15% seats. And All India quota, which is like the cream, the best of state government medical colleges, and the 15% seats, there are a total of about 5,557 MBBS seats. So say about 5.5 thousand MBBS seats. So this is a good number. So if you have got a ranking above better than 5,000, if your marks are above 650, then definitely you have a chance to get into the All India quota. Okay, so that is the advantage of getting an a marking above 650. You can get an All India quota seat, which is the cream seats. Now, you asked about the seat matrix. Before I go to seat matrix, let me just complete the MCC counseling. Through the MCC counseling, you also get admissions to deemed colleges. Okay, so what are deemed colleges? So a lot of students get confused. Even MBBS students or even doctors sometimes do not know the difference between a deemed college and a private college. Okay, so a deemed college is a private college, but it has been given a separate university status where it can conduct its own exams and awards its own degrees. Whereas private medical colleges of the state, they come under the state university. Okay, so private colleges such as MS Ramaiah Medical College is affiliated with the Rajiv Gandhi University, which is the state government university. But you have KMC Manipal, which is a deemed institution and has its own university, or rather it provides its own degrees, conducts its own exams, and these deemed colleges are probably considered to be better than private medical colleges. So if you get an opportunity as a NEET aspirant, as a student, if you get an opportunity to get a seat in deemed college, if you're not getting a government college and if you're getting a deemed college, then it is worth finding out about the deemed college and getting an admission there, because they usually are quite good. They have a good number of patient outflow. Of course, the fees will vary a little bit, but yes, deemed colleges are good. And 100% of the seats of deemed colleges, the counseling happens on the MCC portal. Also, 100% of the seats for the central universities, all the AIMS, all the JIPMER, then Banaras Hindu University, Aligarh Muslim University, and MGIMS Wardha, the 3 central universities, also the counseling happens through the MCC portal. Now, private medical colleges, or the private medical colleges which are attached to the state universities, For them, the 100% of the counseling process occurs through the state counseling process. I would quickly like to share a slide to tell you about the seat matrix of the state government. Is my screen visible?
Yes, sir.
Okay, so thanks to the team of Medical Mentor, I was this is a seat matrix that I could prepare for. So just to make people understand the concept of various kind of seats, this is what exactly you asked me, right? If I'm not wrong, the matrix that you wanted to know. Was this what you were referring to, Dr. Priya?
Yes, sir. Yes, sir.
Yes, sir.
Okay, great. So this is how the counseling occurs at the state level, where you have the KEA, or suppose we are talking about Karnataka state, we have the KEA that conducts the counseling for 85% of the government medical colleges. Okay, sorry, 85% of the government medical seats. So 85% of the seats in government medical colleges. Now there is something called private medical college government seat, where the fees is less. So these are 40% of the seats. Then you have private medical college and private seats, which are of two type. 20% are general merit private for students of that state itself. Then you have 20% seats which are open for students of other state. And then there is 15% NRI quota, and there is management quota, which is another 5%. The matrix is a little different in private medical colleges with religious or linguistic minority, where you have 25% government seat, then you have around 36% seats for reserved for religious and linguistic minority, and we have around 9.5% seats for general merit private, and 9.5% seats open for students of other states. So the beauty of the seat matrix in Karnataka is that a good number of seats, even in this sector, even in the lower fees sector, is open for students of other states, apart from, of course, the NRI and the management quota. Okay, so I hope this answers your question.
Yes, sir. That was very beautifully explained. A lot of people have doubts regarding what the splitting is, what a government merit seat means, what it means to take a merit seat in a private medical college. So thank you for shedding light on that, sir.
Sure.
The next question: what all are students supposed to keep in mind and keep ready while prior to option entry, prior to the counseling process?
Okay. Now, firstly, what I would want to tell anyone and everyone with respect to be ready about when you're talking about option entry is, do not just blindly listen to any uncle, any chacha, any dodappa, chikappa, any neighbor who has anything to say about any college, or, oh, I went to this doctor, he passed out from this college, he was such a good doctor, and so you should also join that college itself. No, in today's time and era, I would tell all my NEET aspirants that you are in the information era. Now, when I was writing my exam in 2004, when I wrote my Karnataka CET and All India Pre-Medical Test, which was it was called so at that point in time. So we didn't have too much access to even find out who is the senior who wrote the previous year exam, or meet someone just randomly and find out how the college is. Today you're in an information era where you can easily find out. You want to find out who is there in first year BMC Karnataka, who's there in first year Ramaya Karnataka. There's several Facebook groups, there are several Instagram communities, there are various ways to get in touch with people. And I would say make use of this opportunity. You're in this era and you're in this beautiful time. Congratulations to you that you have completed your NEET, you have completed your you've got your rank, and now you're thanks to the Supreme Court and all these juggling that's happening, that you have got an extended time to do more research, about what are the possible colleges that you can get, and you need to find out more about these various colleges. So again, I have a conflict of interest here. The medical mentor team has made a channel on YouTube, which is called My Career Shapers, on which you have reviews of various colleges given by students of their institutions itself, to tell you about how their institute is, everything about their institute. And I'm sure students of White Army too will be educating their juniors and their NEET aspirants about how their college works. And I'm sure all those who is a part of White Army will be happy to guide any NEET aspirant who contacts me or contacts us, to tell us more about our experiences in our college, so that you can decide which college is good for you. To elaborate more, I would also want to share my screen again. I'm sorry, Priya asks me one question, I take 10 sentences to answer that one question, but I hope
Absolutely fine, sir.
It's good to be elaborate, I guess.
Yes, sir. It sheds more clarity on the aspect.
So this is a slide that I have borrowed again from medical mentor team, but it makes a lot of sense. So before you go for your counseling, please make sure that you have done enough research about all the colleges that possibly you could get for your rank. Not all government colleges are good, and not all deemed or private colleges are bad. This is a statement which I cannot overemphasize on. There may be some new government college which has opened just 1 year back, 2 years back. They may not even have infrastructure, they may not even have patients, but just because it's a government college, you should not rush to join that college. On the other hand, you have a deemed college which has been established for several years, and is having a huge patient load and has a great infrastructure and team of doctors to train you. Then you should definitely consider it and not ignore it just because it's a private college or a deemed college. So make sure that you have done enough research about the colleges. Yes, of course, the top government colleges of respective states through All India Counselling should be what you should be aiming for, and try for the top deemed colleges also, and check if there are any scholarships that are available for your rank or for your category or whatsoever. Before doing the option entry, if you're choosing a college in any other state, make sure, are there any bonds to serve? There is any rural internship and rural service bond, or any such bond, or if you're taking an admission in a college like AFMC, there is another bond which has recently been increased from 30 lakh to 60 lakhs. So these bonds are something that you should really check. And please make sure you check, when it comes to deemed universities, what are the extra fees. So a lot of students have this limitation of, or rather most of us have this limitation of selecting a college based on what is the fees structure of the college. Okay, so despite all the merit we have, fees plays a very important role for a lot of us to select the college that we can get into. And therefore you should not only know what is the college fees, but also know what is the hostel fees. Do you have to give any bank guarantee? Is there any miscellaneous fees that the college charges? So please ask your potential seniors from that college about all these details. And is there any changes in the fees every year? Will that apply? Because you would have told your parents something, they would have made some arrangements through various depending on their finances, and if there is an increment in the fee every year, then that may go for a toss. So that also has to be taken into consideration. Also check if the MBBS seats or MBBS college are recognized or permitted. There's something called a permitted category and something called a recognized category. Now recognized colleges are colleges seats which are recognized by the NMC. Permitted are, NMC has done some review or check in the college and said, okay, we permit you to increase these many seats in your college, but it's not yet got recognized status. Maybe after 1 or 2 or 3 years, NMC reviews the college and says, okay, the permitted seats are now recognized. So if it's in a good government college, then the chances of these permitted seats becoming recognized are much more. But if it's in a very new college, then be very careful when you're choosing a permitted seat while taking up your seat. And also most important is try to understand what is the internship exposure of the college that you're getting into, because uh, you know apart from the starters and the dinner served, everyone's waiting for dessert. So first 4 years is, I would say, just the menu card. Your actual starter, dinner, dessert is your internship. Okay, so that's when you actually have, and unfortunately a lot of students recently are ignoring internship, trying to prepare for NEET and for whatever reasons. That's a different discussion altogether. But yes, do find out what is the exposure of that internship could offer in the college that you want to get into before you like one of the major reasons for me to join BMC was yes, internship is going to be the maximum exposure. So I just wanted to join BMC. So that ways.
Yes, sir. That also answers the question. And I would, since you've mentioned about the permitted versus recognized colleges, sir, I would like to shed some light on that as well. Because permitted colleges are like, so whenever there is a new medical college that has been granted approval for a certain batch, say 100 or 150, now it is the NMC. Am I audible?
Yes. There was intermittent.
My screen is frozen.
There was an intermittent lag. I think you're back on track.
Okay, so yeah. So earlier was the MCI and now it's been replaced by the NMC. So whenever a new college applies for a first batch, and if NMC as of now finds that all the facilities that they have stated is present in terms of the number of beds, patient occupancy, the college infrastructure, and so on, they would permit the first batch of 100 or 150 students to apply to that college. So it would turn up in the counseling, in the seat matrix. On the other hand, when we say, and permission is something that is used to be granted on a yearly basis before. I don't know how NMC does it now. So when they say one batch is permitted, so in 2016, for example, there was a couple of new colleges which were there. So first batch is permitted that year. The following year, MCI found a couple of colleges did not meet their requirements, so they did not allow the next batch in, and so on. Recognition, on the other hand, would come in when the first batch of that new college would graduate. And for that, the requirements again will go up. It wouldn't be as light as permission, I mean, granting permission for the first batch, but the requirements in terms of their bed occupancy, OT rates, and the college infrastructure would be going up exponentially like that. So that is also very important to keep in mind, like you said, before applying for a college. So that was it.
Great. Thank you for that.
Yes. And the next question is that, so how does one work on the option entry list? That would be a continuation of my previous question.
What was your previous question again? I thought this was your previous question.
No, so that was what to keep in mind.
Okay. So what to keep in mind while doing...
Yes, sir. The previous question was what to keep in mind during option, I mean, before the option entry and, like whatever you mentioned. Now, when they're going in for the option entry, there are a lot of colleges and there are a lot of quotas and a lot of confusion about the list of colleges in the option entry.
I'm sorry, Priya, I lost you in between. There was some voice issues. So
the process of option entry, sir.
The process of option entry. So are you, in other words, asking me the process of counseling itself?
Yes, sir. Yeah. Part of counseling, and then during the option entry, I mean, before it starts, they have to put in that list of colleges according to their preference. So that is a pretty long, exhaustive list they have to work on. So any guidance on that?
I'm so happy that I don't have to do it ever to get into.
An exhaustive thing to do.
But if I think about it, it sounds crazy to me, because a few weeks back, I had a NEET PG aspirant who came with such a list, and I was like, okay, he was all over the place, and we were trying to help him out to how he could bring it. And I realized it's not such an easy, process altogether. But I have tried to put the counseling process into a slide again. if you allow me to share my slide, just a second. Kishan, are we on track? Am I going too slow?
Yes, sir, perfectly. We are all enjoying the sessions.
Okay. Okay. So basically, when you go to All India quota, okay, and rather the MCC counseling, there is so once the MCC announces that you can appear for the counseling, you have to do a registration on the website. You have to pay a registration fees. You have to pay a security deposit. Okay, the security deposit amount will vary from 10,000 rupees to 2 lakh rupees, depending whether you are applying for only all India quota seats, or you're applying for deemed colleges as well. So if you're applying for deemed colleges as well, your security deposit will be 2 lakh rupees apart from the registration fees. Whereas if you're applying only for all India quota or central universities, your security deposit will be only about 10,000 rupees. Now this security deposit is refundable if you do not make mistakes in counseling, or you do not reject the seats that are allotted to you by the second round. If you reject the seats, or if you do not take the seat allotted to you in the second round, then you will lose the security deposit that you have paid. Okay, so now coming to the point of option entry. So when you are entering the choices on the list, what all should you keep in mind? You should keep in mind what is the last year's counseling stats. Okay, so have a rough idea based on your rank. What were the possible colleges that were available last year, or the last to last year, for your rank? So another up and down 5 to 10 colleges you need to keep in mind. So that would be a rough idea for you to understand which are the colleges that you could get. This last year data and current year data may vary if there is the new reservation that comes up. So that also needs to be kept in mind. If the new reservation is coming in, so the seat matrix is going to vary, and there will be new colleges coming up. So again, seat matrix is going to vary. So it's going to be a tricky process. Make sure you also have your dream colleges. I know there will be some of us whose rank is not very good, but don't hesitate from putting your dream college on the top of your options. You never know, somehow maybe second round, third round, if some seat vacates, you could still probably get a seat. So always have the best options that you would want to be a part of on the top, and then slowly get more and more realistic. Of course, you would want to put government colleges first, deemed colleges next, and then of course, in an MCC website, you have only these two options. So once you enter the choices, make sure you have not made any kind of mistakes. View it, see it again and again, take a printout of the screenshots. Make sure, because what you see on the screen may not be very sometimes may confuse you. So make sure you have taken a printout of the screenshots and you review it again and again. Discuss it with a friend of yours who's got a similar rank such as yours. So you both can discuss your lists. That will help you, and you will be given about 4 to 5 days time usually, where you can modify it and then finally lock the choices. Once you lock the choices, and at the day of allotment, there is a lot of processing that happens based on all the choices and all the options everyone has put, and there is a allotment of seats. So what are the possibilities when a seat is allotted to you? You wanted a particular college. Say I wanted Bangalore Medical College. I got that college. I'm happy with that college. I report to that college. Formalities are done. Now, suppose I wanted Bangalore Medical College, but I was given Mysore Medical College. I'm okay with it. I report to the college within 7 days, but then I have to express my willingness to upgrade during the at the college. This will make me eligible for the second round of counseling. If I don't do that, I will not be eligible for the second round of counseling. The third possibility is I had entered one option called XYZ College in outskirts of Bangalore, but now I know I don't want to go to that college. Someone said something very bad about it to my father, and my father is like, no, I'm not allowing you to go to that college. So I'm not taking up that college. I can reject that college in the first round of counseling without losing any money. And I will still be eligible for the second round of counseling. The fourth possibility is no college has been allotted to me at all. So this was the first round of MCC counseling. In the second round, what happens? So after the first round of MCC counseling, there is the first round of state counseling. After the first round of state counseling, you will come to the second round of MCC counseling. Again, so all those who have expressed willingness to upgrade, all those who have rejected their seat, and those who were not allotted seat, they are eligible for their second round. As well as if you have not attended the first round at all, you can pay the registration fee and security deposit and directly appear for the second round. That possibility is also there with MCC counseling. And whatever choices you had entered in the first round, they get erased. So they get null and void. So you need to enter fresh list of choices. Again, do all that research that I've told you about, keep all those points, make sure, view it, modify it, lock it. And second set of seat allotment happens. Now, this time from MMC, I've upgraded to BMC. I wanted it and I finished the formalities. After the second round, when you have taken a seat, you cannot upgrade further and you cannot leave the course. That is an important point to note. Point number 2 is, suppose you have been allotted a college which you do not want, you can reject the seat. You can not report to the college. You can exit, but you will lose the security deposit, which would be 2 lakh rupees if it was a deemed, and it would be 10,000 rupees if it was a all India quota seat that you were rejecting. And this is the end of all India round counseling. So all India quota counseling happens in only 2 rounds. Whatever seats in all India quota are left over at the end of 2 rounds, they get transferred to the state quota counseling. Okay. So, however, you can continue for on the MCC portal for the remnant seats in the deemed colleges and central universities, including AIMS and JIPMA. Third round of counseling is pretty much similar to the second round. You can freshly apply for the third round directly. If you have not got a very good rank and you know that, okay, you'll not get all India quota seat, you may just get a deemed college, people can directly apply for the third round. Or else although I would strongly advise against it, my advice to every NEET aspirant would be, sit through all the rounds of counseling. You never know which dream seat opens for you. You never know who before you decides not to do medicine and decides to do engineering and a seat opens up to you. I have a lovely story about this, and I would like to share at the end of, because we are running short of time, I would like to share this personal experience of getting a seat in Bangalore Medical College and how miraculous it was, maybe if time permits at the end of the session. But yes, so the third round is pretty much the same. The only thing is that you can, if you exit or if you reject the seat that was allotted to you, you will lose the security deposit. And if a seat is not allotted to you, you can appear for the institution level stray vacancy round, but there won't be any fresh registrations for the stray vacancy round. I hope this appears a little lucid, Priya.
Yes, it sort of makes the whole tedious process simpler. So is it the same process even when it comes to the Karnataka counseling as well?
No. Karnataka counseling. So the way, I don't have the slides ready for that. But Karnataka counseling, there's an important step called option. You have to choose 4 options. So what are the steps different in Karnataka counseling, if I were to tell you, is document verification happens before counseling starts. Now the difference between MCC and Karnataka is in MCC or All India counseling, you have to finish the counseling. When you report to the college, there the document verification is happening. But in Karnataka, there is a step where you have to upload your documents. Once you upload your documents verified status appears, and there will be a list that is issued saying that these set of students, their documents is verified and stuff like that, they will be eligible for counseling. So that step is happening before. Secondly, you cannot have fresh registrations in various rounds in Karnataka counseling. You have to register, all those who want to appear for Karnataka counseling have to register before the first round itself. You cannot register directly for the second round of counseling. No, that's not possible. So, and thirdly, when you're choosing an option, like in the MCC, you have first round, you can either report, not report, and all those things. There is, you have 4 choice entry. 1, you take the college that has been given to you. 2, you take the college, but you want to upgrade. 3, you want to reject. 4th, you want to appear for the other. So there are options which you can enter, and you don't have to physically go to the college and report. So there are a little bit of changes, and it's a little more complicated, the state counseling. And actually, we as a team of medical mentors, we hold webinars every Sunday for both NEET, UG and PG aspirants. Now more so for UG aspirants. PG aspirants, we just finished, I think. So I would help you with the details, and you can register for the webinar where we'll have a more detailed understanding of the total counseling process.
Thank you, sir. And sir, like one last question. Now, if the student actually doesn't get, I mean, this is something which people do bear in mind while counseling, say they tried applying for a dream college, they haven't landed there, and they choose whatever option they've got. Now, this is one conversation that happens where they, at the end of first year of medical school, they have an light on that as well.
Sorry, I lost you after they have an option of
getting transferred at the end of first year to another college.
Interesting. So to tell you very honestly, I do not know about this process of this procedure of transfer or the process of transfer. I have known 1 or 2 students of my friends who applied for it and done it, when we were in MBBS, but I honestly do not know what is the current procedure of transfer.
Right. Kishan, any more questions? So am I audible?
Yes, you're audible. You're audible, Priya. So I think we have done a lot of questions on the whole counseling process and how to apply for various colleges. You want to hit the next segment about managing how to do MBBS. That's what Kishan was mentioning about. Or
yes, sir. Sorry, I was logged out once. Sorry. Sir, yes, next we want you to share few of your experiences in first year of MBBS, sir. That would be motivating a lot of students.
Okay, let's call it first a few of our experiences, because both of us.
Yeah, okay, fine.
Both of us from the same medical college. Although the funny part for all our listeners is that I was in final year. No, I was in internship when you joined, Kishan.
Yes, sir. Yes, I have an internship.
Yes. So when Dr. Kishan joined first year MBBS, I happened to be in internship, and I happened to do the orientation to MBBS. In fact, we had just started that program of orientation. That was the second year of orientation that we had conducted. So the beauty about conducting an orientation is interacting with our juniors without having to rag them. So, and it is so nice to see those young, energetic faces, those anxious faces. I still remember when I entered MBBS on the first day. So I was CT rank 50, And my best friend from Christ College who was there with me, Dr. Neeraj, he was CET rank 27. So both of us were nudging each other and saying, hey, look at that, Bharat Holla, he's CET rank 1. Oh, he's CET rank 2. Oh my God, looks like all toppers are in BMC. Oh my God, So that is the kind of conversations we were having on the first day of MBBS. And next thing you know is, okay, the first rank of MBBS, that's first rank of CT is in your own dissection table. So after first week of your MBBS, you no more know people as ranks. Ranks don't matter. Exactly. It's all about dissection tables. He's from the first dissection table, he's from the second dissection table. It's all about first batch, second batch, and of course friends. So how life transforms from competitive exams to a more educative course that we become a part of, the profession that we become a part of. So I remember one a student, I do not want to take his name on camera, but he approached me along with his friend after first month of MBBS, saying that, sir, I'm coming to you because you had the orientation for us, but I don't think I want to continue with the MBBS course. I want to drop the MBBS course. I find it extremely stressful. He had come from a different city, so a different town in Karnataka, and he was staying in the hostel, and he was not getting adjusted to the hostel food, the seniors, and mostly the course. Because when we start doing MBBS, it's not just starting a new subject, it is starting a new life. I feel, all my NEET aspirants, this is the last time that you will be teenagers. After a month you will be called medical students, and that will be your you will be branded as medical students for the next 5 years. Okay, and medical students are different from engineering students, are different from commerce students, are different from MBA students. So I don't want to stereotype things, but it will eventually happen. It may eventually happen, because the way you look at things is going to be different. The minute you look, so as you start becoming a final year student or an intern, the minute you start seeing someone's arms, the first thing you'll see, okay, can I cannulate him? Can I draw blood from his veins? That is the kind. So your mindset is going to change. So the first few months of your first year MBBS is going to be tough. Going to be tough because as Dr. Kishan was telling me the other day, it is not about learning, just a new subject. It's a new language. So first,
Latin and Greek, not even English. You may be the topper of English. You may have scored 100 out of 100 every year, but it's medical. It's altogether it's different. You need to be learning all the Greek and Latin words. So initial 2-3 months, you'll find it really difficult to comprehend the words, to remember them, and to reproduce. So all of us, including the topper Govind Mittal sir to the bottom topper Kishan Rao, have faced all the problem. Okay.
Yes. You can lie well on camera, huh?
Sure.
But yeah, everyone takes time, and believe me, you need to give that time. You need to give that time to learn anterior, posterior, superior, lateral, inferior. So all that things you will have to take time, give all your time and energy. So I was just listening to one of the what one of the deans had to say from a medical college, saying that a lot of students in their first year, they fail in the first term, or they don't do well in the first term. Is one, because they get carried away into a new course, new hostel life, new college life, and all those things. So my sincere request to all students will be, do not lose the flow of being a student. You want to learn a new course, of course, do not compromise on the enjoyment, do not compromise on what you're supposed to enjoy as a first year medical student, but make sure you give the first year of medical college its due. You must give a lot of time to anatomy. In fact, my senior was very, very crisp in what he said. Kishan, if you remember Dr. Ajay Kashi, who's
Yeah,
actually
yeah,
a
because-
pediatric,
yeah.
he was my mentor.
Yeah.
So he's a pediatric pulmonologist in US right now. And he was very clear. Every day after finishing your college, you have to study for 5 hours.
Okay.
2 hours of anatomy, 2 hours of physiology, 1
Yeah.
hour of biochemistry.
Yes. Yes.
He said, so what I want to tell students is that your journey of studying does not stop with the NEET exam. Rather, it starts with getting an MBBS seat.
Yes.
It is not tough, as in it's not undoable. We all have done it. It's just that we need to be focused, and believe me, you will enjoy it. You will simply enjoy the journey of being a medical student. I wish I was a medical student again, except for the exams. But yes, definitely it is going to be an enjoyable journey. Don't be worried.
What I want to add to that is, yeah, most of them think that MBBS means only studying. Oh, it's only for the nerds, or it's only for, it's all about bundles of books and heavy studying. It's not so. It's not really so. Okay, MBBS really fun filled. Okay, in fact, if you ask me or Govind sir now, tell me something about your MBBS days, we don't even remember single word what we have read, but the only those pranks we did, the dissection table, like you mentioned, what are the fun time we had with our friends.
Definitely.
Because a lot of fun is involved. Okay, you can definitely continue with your co-curricular activities, maybe in the sports or maybe your cultural activities. All the opportunities and options are available even in medical schools. So you need not worry that, oh, if I take up medicine, then I may have to leave all my hobbies and concentrate only on studies. Nothing like that. Why medicine or medical field becomes so tough? Because there is nothing called out of syllabus, or there is no specified syllabus for you. Because when in the future, when you become a doctor and sitting in a clinic, patient comes to you and you can't tell him that I have not read about this particular topic or not read this particular disease, or this is out of my syllabus. You can't tell that. You need to be helping the maximum needy. So you need to be studying vast.
In fact, I think Corona has been the only time where I have told patients, actually, sorry, we don't know much about this disease.
What a tragedy! No, we had read only one paragraph. You remember? I still remember. There was only about Corona in our microbiology. Now it has become like volumes of books can be written on that. What a tragedy! We don't know. So what as a doctors now, from my side and Govind's side, what I can I say is, reading is something, and once you become the doctor, the practical aspect is totally different. So just get into a medical college and read as much as possible, and try to get maximum exposure in practical side also. And after that, the practical, the real practice is going to be totally different. But with the good knowledge, you get a lot of confidence. Okay, you get a lot of power. So with that, you can manage everything.
So very important for you to pay attention at the why MBBS is tough. Like Dr. Kishan was saying, is like other branches, you can't bunk classes, or you shouldn't be bunking classes. I mean to say, the reason that Kishan wanted to tell me about importance of dissection.
Yes,
right?
sir, yes.
So unfortunately or fortunately, I was one student who had 100% attendance in dissection hall.
Yeah, same here, sir. I passed my anatomy just with my dissection knowledge, sir. I hardly read the theory, but I used to every day do dissection without fail, sir. Even it may be skin dissection or fat dissection, whatever it may be. Even now, I tell the same thing to my juniors. I passed anatomy just because of my dissection. Such a wonderful experience.
So it is important, as soon as you enter the medical college, I know anatomy is going to be one of the most challenging subjects for you. You can get adjusted to biochemistry and physiology, but anatomy is going to be challenging.
Biochemistry is nothing but the continuation of your 12th standards, or almost everything.
Exactly.
I passed again. Biochemistry also I passed. I could remember all what I've studied in 12th, that DNA recombination, all those things. Even now I remember. So it's like
half of biochemistry is what you have done in 12th. Yeah. But yeah, that's the only comparison with 12th.
And one more thing I want to add to all my friends and viewers. Okay, see, Govind sir, I didn't mention in the beginning, he had being a medical student, he had written a book for medical students, other students. The second year, we have a subject called pharmacology, wherein we'll be studying in detail about all the drugs, in the sense medicines, how to prepare medicines, how they act, how to be given, how, like, what are the organisms it covers, everything. So to make it easier and simplified to the students or fellow friends, he had compiled all the medicines, especially its classifications, and put it into a proper book form. And it was very much useful, especially young juniors like me. That book was very much useful on a classification book on pharmacology. Even now, it holds really good for all the students. So again, a great achievement and a great attempt by sir to help others. That shows his passion to guide the juniors and also to help others. So Priya, meanwhile, we'll have 2 minutes of chat with Ms. Charushi also.
Yes. I've taken a lot of screen time.
No. Charushi, are you there?
Charushi, are you there? Sir, am I audible?
Hi, Charushi.
Hi, sir.
Yeah.
Hi, Charushi. I hope I'm not bored the
No.
out of you.
It was like a recapitulation for her own process. Yeah, Priya, you can take over.
So Charushi here is my junior from Ramaya Medical College. She's in first year. She's come from Delhi all the way to Bangalore to study here. So welcome, Charushi. So can you please share your experience on how you transitioned from that phase in 12th standard to first year of MBBS? How were the first few months?
In 12th standard, I remember being one of those brainy kids in school who knew everything, and coming here, getting an earful from teachers during vivas and barely managing to pass. It was a very challenging thing to accept. But then you slowly you get accustomed to the course and how you have to go with it, and how much you need to study, how much effort you need to put in. So gradually I got into the flow, and finally I did manage to pass with around like a decent score in my internals. I'm yet to give my final exams.
Charushi, you faced any problems during your counseling process or during admissions?
Yes, actually, my score was around 600. So, as per the previous trends, I was expecting my rank to be under 10,000. But that year, ranks dropped quite a bit. So, I had to look for alternatives. I explored a lot of colleges, like what are my options. So, then I also hired a counselor to counsel me. Then he told me about this Karnataka counseling. So I looked for colleges. I came across Ramaya, I came across KIMS. So these were the best in Bangalore, apart from St. John's. So then I applied for KEA. Then I got into Ramaya finally.
Yeah, you were a topper of your batch in 12th. You were always excellent, brilliant student. And unfortunately or fortunately, somehow you missed some ranks, and now you got into Ramaya, MS Ramaya Medical College. But
Yes.
I'm sure that you're happy now. What do you say? At the end of 1 year, irrespective of the place where you are in, and irrespective of the marks what you have got, I think you're very happy. You seem a very happy student, aren't you?
Yes, sir. I have no regrets.
Yeah. Have you explained to others, like your studies, about how first year in studies, how your dissection you're enjoying? I think you are not attended much because of the corona, the dissection and other labs, biochemistry labs and all. But otherwise, you're quite happy, no? Now you have no regrets about the college or the place. Maybe you had to come all the way from Delhi to Bangalore. I don't think you have any regrets.
No, sir. Bangalore is a really nice place, and dissection is my favorite part of the day. Of all the things, first year, I am going to miss dissection the most.
Even now, Charushi, not only you, even if you ask me after 10 years or 15 years after medical school, if you ask me one thing I want to do again, or if you given me a chance to recorrect, even now I say the same thing. I want to go back to the first year MBBS. I'm not exaggerating, but even Govind sir will agree with me. I want to go back to first year again and learn anatomy, physiology, and biochemistry again. I want to do dissection even now. After becoming a surgeon also,
I
feel that.
so agree, so agree, Doc. And Charushi, looking at the ways of learning, I would say you guys are gifted. I
Yeah,
mean to say, anatomy can be learned with three-dimensional
yeah.
videos, with so much of material. I
Virtual.
mean to say, yes, virtually, and believe me, it's so beautiful to learn virtually. Things we were trying to understand.
Imagine
Things,
now what
yes,
yeah, we have to imagine, sir. It was very difficult to imagine for
yes,
ourselves.
yes,
But
yes.
for them, now everything is reconstructed in the 3D models in front of them.
Remember buying an atlas, anatomy atlas. So Charushi, there used to be a concept of anatomy atlas. I don't even know if the current MBBS students know what an
Yes,
atlas is.
we do have that too.
Huh?
I do have that too.
Nectar's
Yeah.
Atlas. Nectar's, I
Yeah,
think.
Netter's atlas. So having an atlas would be, that okay, you need to be the richest guy among the
Yeah, it is very
batch. Atlas used to be a very costly affair. Much costlier than all the other books, and you'd be like, okay, let's borrow atlas and study. But now you don't need to borrow. I would say your YouTube has visual video atlases of every part of your body, so that's so beautiful. You guys are lucky.
We had, sir, I still remember watching Auckland's video. One ball professor Bal used to.
You were 6 years younger to me, so you would have still things which I didn't have.
Charushi, and what do you suggest your juniors about taking up medicine, medical field, and how can they excel in doing first year MBBS? What are your suggestions?
So I believe that one should take up medicine only when they're very passionate about it.
Correct.
Because if you're not passionate about this field, then I don't think you'll make it through 5 years, because it requires a lot of effort, and you will be willing to put in that effort only if you dreamt of it.
Mm-hmm.
So I thought of becoming a doctor in 2nd grade. So I had a lot of passion, and I have I'm very motivated to finally.
Why you took up what was your why you took up medicine basically? What is your dream or aim?
So I really wanted to serve the society and help. And biology, I found it very interesting. So
see, what Charush is trying to say is just because it from outside it looks very fascinating, that white coat with or the stethoscope hanging around you, it looks very fantastic from outside. Just with that outlook, you should not take up medicine. But if you really have some goals or ambitions to serve the needy, or what to say, if you want to really do well, only then take up if you're really passionate.
There
That's
is
not just
another important point I want to make here, Dr. Kishan. Recently, this is a real incident. Recently, I had a junior who actually came to me and asked me, sir, what will be the return on investment on my education if I take up MBBS? Okay, so believe me, if any of you who are even going to enter MBBS today are entering MBBS with the primary understanding or objection that becoming a doctor is a very lucrative opportunity where you can earn a lot, please take a step back. Please take a step back. Okay, the best return on investment for your fees you can get is by putting your money in mutual funds for the next 10 years. Okay, not in an MBBS college. You want to become a doctor because you want to become. Not that it's going to offer. Believe me, your engineering friends, your friends who do commerce, BBM, MBA will earn much more and earn much faster before you even step out into the society. So do not take up this course just because it appears lucrative, it appears fancy. I'll have some respect in society. No, it's about you enjoy doing this course. You want to become a doctor. And I thoroughly echo with what Charushi says.
What I felt is why I took up medicine, because at the end of the day, you may practice or not. You, like sir told, you may make money or not. Ultimately, I'll be knowing about myself better than anyone. Okay, I'll learn about myself. Okay, how my body works, how I am functioning, how I can do better. At least I can, at the end of the day, I can treat my parents at home in some or the other way. I can help them. So that's the beauty of medical field. Okay, although we are discussing all the pros and cons, ultimately it left to you individual. Okay, irrespective, just like Charushi mentioned now, where you study, how you study, and all these things barely matter at the end of the day. If you're really passionate, if you're really good, okay, if you study well, you will definitely going to succeed, irrespective of the college you take up and whatever the circumstances are. Okay, they hardly matter to you. So, Charushi, some concluding remarks from your side, please, to the lovely juniors out there.
So I'd like to say that it's a very beautiful field if you love it. And once I noticed in my childhood, I went to a doctor, and there were two elderly people who had for the treatment, and when they told her, "Thank you, doctor Sahab," so that is when I felt like I want this feeling, like I want to be told this by somebody. So that is a very beautiful feeling, to be able to help somebody, to be able to alleviate somebody's pains. So it's a very beautiful feeling, and you have to give a lot of effort and a lot of dedication and determination, but the end result is amazing.
You know something? This is the day in, day out feeling for you. Okay, the whole day from morning 6 o'clock till night 9 p.m. you will be working continuously, tirelessly, and at the end of the day at 9 p.m. also you'll come out of your hospital, or maybe, for example, labor room. You come out, okay, after doing some 15 deliveries and other thing. When you come out of the labor room, the parents will be waiting with their kids on their hands, and they'll ask you, okay, madam, please hold my baby, or please keep a name for my baby, and they'll come with some sweet boxes just to greet you and thank you, and they'll hold your legs, and some poor guy will give you some 100 rupees as a tip, something. That is the most beautiful feeling, even though you are already exhausted like anything, when the such kindness is shown to you by the patients or their attenders, you will feel so contented and blissful. Okay, nothing in the world will matter to you, no enjoyment can match this, no fun can match this. So as a doctor, this is a day-to-day effort to you. Okay, keep this in mind. Okay, this is going to be your life. Okay, you will have a lot of such beautiful feelings. So for at least to experience that, at least to get such feelings, you should take up medical field and try to give your best to the society and become the best possible doctor. Sir Govind sir, some more words of reassurance and motivation from your side as a concluding remarks.
Motivation to get into a medical college. I told you, I have a story to tell. I can just quickly say.
Please, sir, please.
So Kishan, I don't know. I think I've not told you the story also. When I was joining MBBS, there were 38 seats in general merit quota in Karnataka city, and I had got 50th rank. So, and that year there was this ruling passed where they said there is no government quota in private seats. So either you have government fees or you have management fees, which was a huge gap. So government fees was 16,000 per year and management fees was 3.25 lakh per year. So a lot of students who could even want to take a private college in their city and were forced to take up BMC in the first round of counseling. And the first round of counseling, I remember being there at the counseling center, looking at the board one by one, and I realized, oh my God, the BMC is getting over at rank 45, BMC is getting over at rank 46. I was like, oh shit. And then my name was called, and I went to this board and desk, and my father said BMC, and I said it should not be available. And that fellow is like, BMC is there, sir. I was like, what? BMC must have got over at 46. No, so BMC is there. My father is like, punch it. And I was like, okay, fine. But I was still not able to believe what I just heard. What I realized was rank number 46, 47, 48, 49 did not turn up for counseling.
Okay.
So these miracles will happen. So all those who are applying for counseling,
we just consider them as coincidences, but they are not so, sir. You are bound to you deserve that. Somehow that power will make you get it.
So when you desire something, I strongly believe in this philosophy. If you desire something from your heart and soul, and if you have worked towards it, the entire universe shall conspire that you shall have it.
Perfect.
From The Alchemist. So
Perfect.
that is my words of motivation to all the juniors who want to take up MBBS. So take up MBBS because you want to do it, you enjoy the field and nothing else. That is my words of motivation and advice to all of you.
Yeah. Priya, are you there?
Yes, sir. Yes, I'm there.
Yes, any concluding remarks from your side to the juniors?
My only thing that I would like to add in is that, I mean, ever since I have joined medicine, what I've realized is nothing is predictable. Every day is such a new story, a beautiful journey. Every day has its own challenges. Every day it's like you're dealing with something new. I mean, there is surely like a schedule, a routine. You go to dissection in the first year, you go to labs, but every day there is something that you laugh about, something that you feel frustrated about, and then at the end of the day you're coming back and you're like, okay, I have something new to look up to the next day, new to wait for. So that is another beautiful part of my story or my journey that I have experienced this far.
So what do you feel now? You have any repentance, regretance, or you're a happy soul?
No, sir, I don't have any regrets. My story has always been like, up and down every new day. So, I really love whatever happens and all the challenges that come across. In fact, it's like I wanted to become an astronaut when I was in school. Medicine was nowhere in my list. And then I came across physics, chemistry, and biology back in like 6th grade. And I realized, okay, physics and math are not my thing. I may not become an astronaut. And then somehow I realized that a lot of astronauts who do go up to space are doctors, and some of them had like neurosurgery background. And I was like, okay, maybe I'll become a doctor and I'll become an astronaut and I'll go up to space. So that's how the madness started. Okay, like then slowly, of course, the reason why I wanted to become a doctor did change. It was not just about becoming an astronaut, but it's about the vast depth of knowledge, the uncertainties, and so many things that you get to learn, so many things that you get to see. So that sort of passion sort of drove me to whatever I'm here doing. So yeah.
Perfect. So then do we have any questions from the audience? Mr. Shaunak or Anusha, and anyone has any questions? So because you can directly interact with the mentor here and you can get it clarified. You not get such opportunities elsewhere. So if you have any doubts, you can get it clarified now, or else otherwise.
So one question is there. That is, if people after joining medicine at some point, start questioning their decision or start having this block that, okay, I'm not feeling the same kind of passion or that interest which I felt before, what are they supposed to do to come out of it? Or what do they do? What advice would you give to them when they're in such a scenario?
Okay, so many times I feel this is not the real reason. So people by the end of 6 months will know for sure whether they want to do medicine or not. I rarely, after a year or so, people want to quit the field that they have chosen. So they have to this has to be analyzed on a case-to-case basis. Why are they getting that feeling? Was there something that happened to a senior, something that happened to a friend, something that happened to a family member? Is there a financial crisis? Is there a love, loss of love, or you had a breakup, or your girlfriend left you, or boyfriend? There would have been some reason for someone to so strongly feel that after doing a few months or few years of MBBS, they don't want to do it. In that kind of a scenario, I mean to say, reach out to your friends, family, and mentors. Yeah. Because there are people there will be your seniors who have been there, done that, been in that situation. If I still meet that student whom I had counseled, he said that probably if you had not counseled me to continue with MBBS that day, I may have not continued in MBBS. I would have gone back to my town. So so you have to always seek opportunities, seek help. Yes. And believe me, people are waiting to help you around. It is if anyone who has a closed mind, it is us. We feel scared about what will the other person think. Is it okay to approach? yes, it is okay not to be okay, kind of thing. You can approach, whomever you want to. You will have. It's not a smooth ride.
But yeah, you have to open up by yourself. Nobody will come asking you, do you need help? Do you need help? Nobody will come like that. You need to ask for help and seek the proper guidance and help from your side. I always give the example of ECG. Okay, see how the normal ECG should work. You should always go up and down. Okay, up and down. Then only it's normal. If it's going only upwards, then it's abnormal. Okay. Similarly, if it's going only downwards, then also abnormal. If it's going straight, you know what it means. ECG, if it's going in the straight path, then also wrong. So to normal heart or an ECG, that works in a way that there should be always ups and downs. So minor setbacks, my feeling low sometimes, some kinds of stresses, always there, always there. But always take the advice or the help from the seniors or whomever you trust in, and always take the proper guidance. That will definitely help you to do better in life. Even now, after becoming consultants, even now we feel low many a times. We feel why we are here. All our friends are doing much better than us. Why we are here? Why we are struggling like this? So, but I just like told some patients, some kind words, some we try to grab some opportunities or motivations from here and there. Then we try to keep ourselves in the path and self motivate ourselves and try to go ahead and help others. So always some minor setbacks, always it will be there, but don't give them. If you give more meaning to it, or if you stress it more and more, then it will become a big problem or a chaos. Or if you just ignore it, if you just see the positive side of it, then definitely you will go ahead and succeed. That's the take home message for today. I think sir, the baby is waiting at sir's home, so sir has to leave. It's already getting late.
No problem. I don't, anyone from the White Army or students are free to contact me on my email address or my, even my WhatsApp number. You have any doubts, you want to reach out to me. I perfectly.
Sir, one question. Miss Anusha has asked you, sir, I have completed education in Karnataka since 8th standard. I have been studying abroad in UK till that due to dad's job. Will I be applicable for Karnataka state quota? She's asking.
This may not be the case. There is a thing called domicile certificate where you have to show
minimum
at least
10 years. No?
7 years. 7 years.
7 years of parents.
7 years of if the parents are domiciled, she can get.
Yeah,
or
no.
She has had 7 years in Karnataka. I think the better person to contact with the exact details for this will be Mr. Vikram from the team of medical mentors.
She can mail you, or can give the mail address, email ID or something.
Yes, just a second.
Chat section.
So I will even announce it so that because the chat section will be visible on.
Yes, sir. It will be
visible to all on YouTube as well.
No, in YouTube again we'll put a comment, sir.
Okay, fine. So the number for contacting the team of medical mentors is 8050-367-887. I'll put it in the chat box as well. 8050-367-887. So that is the team of medical mentors.
And
you can contact
they can
them.
give the reference of Dr. Govind Mittal, and also they can tell you are a member of White Army, so they will definitely help you with all the counseling process and also the admission procedures.
Yeah. So medical mentor is actually a paid service. In the initial first one-to-one counseling is completely free of cost. So if you want anything more than that, then it's a paid service and they will help you more with that. And anyone wants any kind of guidance from me or wants to reach out to me, I'm putting my email address and WhatsApp number as well.
That's great, sir. That's great. So Priya, anything you want to add, or shall we conclude the session? Priya, are you there?
So am I audible?
Yeah, you're audible now.
Yes, sir. So no more questions, sir. Sir has answered everything so elaborately. He's simplified the whole process. Lot of doubts which I had when I was, before giving.
I hope I didn't bore you guys.
Clarified everything.
Not at all. It's a very
Yeah,
useful
absolutely
and
not.
session.
Really, thank you very much, sir.
Yeah. We want maximum students. Soman Panda has one doubt. Can you please unmute him? Priya? Mr. Soman has. Okay. Soman?
Good evening, sir.
Good evening, Soman.
Sir, actually, I had a doubt regarding the state quota and all India quota because I have been studying in Karnataka from around 10 years. So I think I'll be eligible for the state quota. Sir, so in case I get a good rank in all India quota as well as in the state quota. So in case I want to go in BMC, so which quota should I apply in?
All India. Govind, sir?
Yeah, why not?
There
is a fees difference. There's a fees difference also.
Fees difference and more than for the bond also. Sometimes always it's better to take from all India
quota. Yeah, the chances of
you may be exempted from serving the bond. Okay. So if you're getting through all India quota, then please go for all India quota. It's always better. Okay. Soman, is that clear?
Soman, you're muted. Oh, he says yes. Okay.
Okay, fine.
Sir, actually, I had another concern. In case, is there a possibility that my all India rank may not be that good, but my state rank will be good? So in that case, can I get in BMC? Is there a possibility in such cases?
Definitely, there is a possibility because you have to understand the dynamics. All India quota is only 15% of seats in all the medical colleges, all the state government medical colleges across India. There are 5,557 seats, MBBS seats in the all India quota. Okay. And whereas the rest 85% of the seats in government colleges are in the respective state quota. So depending on your rank, you will definitely have a different dynamics to play with. And that is why we discussed the choice and the chances of how to select, which college to select, and so on and so on.